Welcome to Invisalign. In this video, we will be going over all the information you'll need to know about your Invisalign treatment. We'll answer questions about what to expect during the first few days, how to wear your aligners, and how to take care of them. Invisalign uses a series of translucent, removable, and comfortable aligners with attachments to straighten your teeth. The attachments themselves are small, tooth-colored shapes that are bonded or glued to your teeth, and they will stay there throughout your treatment. Attachments act as handles to allow the trays to grab onto the teeth and move them efficiently. These are each predetermined by the Invisalign treatment plan on a case-by-case basis, and they are later removed from the teeth once your treatment is complete. Each set of aligners must be worn for a total of 300 hours for the teeth to move. That means wearing them for about 22 hours a day for 14 days. To keep track of when to change your aligners, you can use the app called My Invisalign app. It is available on both Apple and Android products. If you do not wear the aligners for the recommended number of hours in that 2-week span, continue wearing the same set until you've made up those missing hours before switching into the next set. If elastics are prescribed as part of your treatment, Dr. Nick will advise if you should wear them full-time, which is 22 hours a day, or nighttime, which is about 8 to 10 hours a day. If they are recommended to be worn full-time, make sure that you place new elastics each time you insert your aligners. The most effective time to switch into your new aligners would be after your last meal of the day before going to bed. This allows your new set of aligners to be in for the longest amount of uninterrupted time. The first 48 hours is actually when the most tooth movement occurs. After changing into a new set, refrain from throwing out your old aligners. It is helpful to have your previous ones stored to switch back into, and will also ensure that your teeth do not shift away from the planned movements. If you lose or break an aligner, insert the previous one that fits and contact the office for guidance. Please be aware that Invisalign does charge a fee per aligner for replacements. If an attachment falls off, the aligner can no longer move the teeth with adequate force. Luckily, we are able to replace that attachment using the aligners that you're currently wearing. Here are a few things to expect when starting your Invisalign treatment. It's normal to experience some extra pressure or discomfort when starting your aligners, so you can take Advil or Tylenol as needed. Another thing that can help is by eating some softer foods for the first few days, such as bananas, eggs, ice cream, pasta, or rice. The next thing you'll notice is that your teeth will not fully bite together. This is because your aligners fit over your teeth and you will essentially be biting on these instead. Due to these aligners being on both top and bottom, you may develop a lisp. The more you talk, however, the quicker your speech will improve. Another thing you may experience are irritated cheeks and tongue. While Invisalign trays are smoother than braces, they are still something new for your tongue and cheeks to get used to. Some warm saltwater rinses or a Colgate Peroxide mouthwash will aid in healing any of these irritations. There are a few different ways that you can keep your aligners clean. The first is by brushing and rinsing them in lukewarm water. The second one would be to use the Invisalign cleaning crystals. And the third would be using a non-gritty toothpaste. Using any kind of toothpaste with bleaching in it could affect the fit of the trays. Be sure to remove your aligners each time you eat or drink. If you're drinking water, the aligners can be left in. However, smoking is not permitted at all with your aligners on. It's important to brush and floss your teeth after each meal before reinserting your aligners. This is because certain bacteria will grow faster underneath the aligners while you're wearing them. By maintaining good oral hygiene, you'll help decrease that bacteria and prevent cavities going forward. When they aren't being worn, make sure your aligners are stored in your case to protect them from being lost or damaged. Also make sure that you're keeping your aligners and the case away from pets and young children. We do not recommend bleaching your teeth while wearing your aligners. This is because your teeth will not bleach evenly and the aligners may become damaged, as they aren't specifically made to hold the bleaching agent. Chewies are small, cylinder-shaped, and made of a soft plastic. They can be rinsed and reused until they lose that chewy quality. In order to make sure your aligners are fitting perfectly, we suggest using Chewies after each time you insert your aligners. The gentle pressure placed on the teeth while biting into the Chewies helps the aligner to fully grab onto the attachments. This ensures a better fit of the aligners. Invisalign recommends the use of Chewies for at least 15 minutes in total every day. While you have your aligners, it is important to continue your regular hygiene routine. This includes seeing your dentist for your hygiene appointments every 6 months, as keeping your teeth clean will ensure the best result at the end of your treatment. Congratulations on starting your orthodontic journey with Invisalign!